Hi, my name is Hannah and I'll be presenting about Proteus mirabilis today. This is a brief overview of the contents that I'll be going over, and I do have short true or false questions at the end. So about Proteus mirabilis, it is a rod-shaped gram-negative bacteria in the Enterobacteriaceae family. It's facultative anaerobe, which means its growth isn't heavily dependent on oxygen. They will grow with or without oxygen. It's found in soil, water, and human GI tract as part of the normal human gut microbiota. It's the main cause of UTI, causing both catheter-associated and non-catheter-associated infection. It causes infection on biomedical devices such as catheters, IV lines, ventilators, and others. A unique feature is that it exhibits swarming motility on surfaces and produces polysaccharide for adherence. This adherence is seen especially on biomedical devices, and when it's grown in agar, it will exhibit swarming motility in a bull's eye pattern. It attaches to human uroepithelial cells via pili and produces urease and biofilms. 90% of Proteus infection is caused by Proteus mirabilis, and it is seen in both community-acquired and nosocomial infection. Symptoms include urinary tract inflammation, like painful urination, cloudy and dark urine, blood in urine, pyuria, which means white blood cells in urine, abdominal and lower back pain, urethritis, cystitis, prostatitis, pyelonephritis, and kidney stone. It can also spread into the bloodstream and in severe conditions cause sepsis. The main way of transmission is through person-to-person contact. It's often hospital-acquired. And exposure to contaminated surfaces and objects can also lead to transmission of the disease. Recent studies show that Proteus mirabilis is found in retail meat and seafood, so ingestion is another possible way of transmission. And since Proteus mirabilis is a part of normal gut microbiota, it can move from intestine to urinary tract, causing infection as it is motile. There are a few methods when it comes to diagnosis. First, the most common method used is culturing and lab tests. You culture bacteria from isolation from infection sites and organs and look for discernible traits such as swarming motility and lactose fermentation. Because other gram-negative bacteria can also cause UTI, culturing is essential. Second, you can analyze urine sample to assess number of red and white blood cells or check for alkaline urine, which all indicate signs of positive Proteus mirabilis. And with the rise of resistance genes in Proteus mirabilis, molecular methods such as PCR Malditorf and AST, which is using electronic devices and software to analyze bacterial growth, are used. For treatment, the first line is trimethoprim and sulfamethoxazole combination. Second line is oral fluoroquinolone, and if the infection is severe, IV injections of antibiotics are used. All of these treatments are generally up to 3 weeks. For prevention, limiting unnecessary catheterization is important because it can prevent hospital-acquired UTI. And maintaining good hygiene and sanitizing biomedical instruments and surfaces is really important. Practicing safe sex is also another method when it comes to prevention, and taking probiotics can help as it creates a low pH which prevents growth of uropathogens. Probiotics adhere to uroepithelial cells, which blocks adhesion sites of pathogens. And frequent hydration flushes out the bacteria out of the urinary tract, and continuous surveillance is important. There has been a rise in antibiotic resistance for Proteus mirabilis, and 50% of strains are resistant to antibiotics. These antibiotics include beta-lactams, aminoglycosides, fluoroquinolones, sulfonamides, and the bacteria is naturally resistant to tetracycline and polymyxin. Most resistance is acquired through mobile genetic elements like plasmid, transposons, and antibiotic-resistant genes. Ability of Proteus mirabilis to accumulate a variety of resistant genes on mobile genetic elements allows it to spread resistance to other bacteria horizontally. Rising emergence of extended spectrum beta-lactamase inhibits the third generation of beta-lactams, and also increasing carbapentamases production has been problematic. Plasmid-mediated AMP-C beta-lactamases especially develop resistance to expanded spectrum cephalosporins. Eventually, this resistance is associated with higher morbidity and mortality. These are the other resistance mechanisms. First, the biofilms. Proteus mirabilis produces urease, which raises the local pH, precipitating minerals and leading to the formation of crystalline biofilms. These biofilms hinder delivery of antibiotics, and they increase biofilm stability, which makes it easier for bacteria to survive antimicrobial exposure. Within biofilm, ARG exchange is easier and works as a physical barrier against antibiotics. Second, porins and efflux pumps work in coordination with each other to reduce intracellular drug concentration, and they act as a barrier against beta-lactams and carbapenems. And third, point mutation in quinolone resistance genes alters target sites for quinolones. Some of the risk factors include unprotected sexual activity, immune system deficiencies which CD4 T cell count is lower than 200 cells per microliter, and females have short urinary tract compared to males, which makes them at more risk of getting Proteus mirabilis UTI infections. Having urinary catheter for a long period of time and taking poor care of it, improper hygiene and other health complications, residing in healthcare facilities, and age. The older you are, the more likely it is to get Proteus mirabilis infection. And these are some of the public health impact and health concerns. Proteus mirabilis is the third most prevalent UTI and the second most common cause of catheter-associated UTI. Multi-drug resistant Proteus mirabilis is associated with nosocomial outbreaks globally, especially in India, Saudi Arabia, Ethiopia, and Nigeria. Resistance is rising especially during therapy, which is problematic, and bacteria can complicate UTI through biofilm and kidney stone formations, which makes treatment harder, and they increase antibiotic resistance. And resistance can also be disseminated in the soil and water, and even through wildlife animals, through ARG and mobile genetic elements. Therefore, wildlife's role in spreading resistance to antimicrobials has become a main topic of interest for researchers. And continuous monitoring isn't also happening. Prevalence is underestimated, and culture sensitivity reports are lacking in low and middle income countries. Secondary infection is very common and they can spread to other organs. Continuous surveillance is necessary to monitor resistance patterns and guide treatment decisions. And we have true or false questions. Proteus mirabilis exhibits gliding motility. This is false because it exhibits swarming motility. Proteus mirabilis is transmitted through aerosols. And this is also false because it's transmitted through person-to-person contact. Biofilm formation can form a physical barrier against antibiotics and works as a strong resistance mechanism. This is true. And Proteus mirabilis is naturally resistant to tetracycline and polymyxin. And this is also true. And these are some of the citations for my presentation. And thank you for listening. Let me know if you have any questions.